So I'm Kimberly Williams. I'm a family physician at Salina Family Healthcare. I'm also the program director at Smoky Hill Family Medicine Residency. The Family Medicine Residency program in Salina is really important for the entire state of Kansas. Our mission is to train family physicians for rural Kansas. So you hear a lot about the state of Kansas and rural areas needing more physicians. We have counties in Kansas that don't even have one physician in the county. So it really puts on us the need to get doctors out into these rural areas. Some of our residents actually come from rural areas, so they talk about, having to drive an hour just to see the doctor. And so maybe sometimes you choose, do I go see the doctor or do I not? And so maybe it's just not worth going to the doctor, and we'll just, do it when it gets really, really bad. And so I think a lot of individuals in rural areas have to make those choices. Also with emergency rooms. So when you are having an emergency and it takes you 30, 45 minutes or an hour to get to the emergency room, that's a really scary time. And if something's really vital, outcomes can be different. Having those services out to where people can easily access them is really important. Because our residency's mission is to train physicians for rural Kansas, that really permeates everything that we do. From day one, our residents inherit a panel of patients. So when they come July 1st, they have a panel of patients that are their patients, and it's their responsibility to take care of them. And so they get to, experience that and train with that, and then they keep those patients through their entire 3 years. Back in 2014, we actually increased from 12 residents to 15 residents, so we added one resident every year without really having more space to do so, but we kind of made cubicles smaller and squeezed everybody in. The other thing that our current space confines us to is that really we're limited to just medical students. We think we could expand that to other specialties, so specifically dentists and pharmacists. So the capital campaign for a new building is really exciting because we'll have more space. So there's going to be a conference center. So the residents will definitely use that for workshops. Then we'll also be able to bring in, outside people. So potentially other residents or other medical students to host conferences there. So that's exciting. And then the workspace for the residents. We also plan to expand our residency and go from 15 residents to 18 residents. And so there's no way that we could currently do that in the space that we're at. Our mission is to train family physicians for rural Kansas. And we're very proud of that and really excited that we get to do that.
Join us in making this vision a reality. Your support will transform lives.